As of yesterday evening, Guyana would have recorded 109 cases and 10 deaths. This is for coronavirus disease. As you know, every day we bring you an update and we bring you some tidbits of information as to how we can all help each other to avoid getting this disease. Very important in this whole paradigm of the pandemic are, of course, what we do with regards to our children. And many of you, viewers and listeners, would have called and would have messaged me, Mrs. Gildhari, to ask us, well, hey, Mr. Yog, do we still take our children for their immunization vaccines? I am a mother. What care and precaution do I have to take if I am breastfeeding my baby in this pandemic? Because babies are born every day. We all carry on with our lives every day. And so today, ladies and gentlemen, to specifically address these questions as with regards to COVID-19 vis-a-vis our children, immunization, breastfeeding, and all of that, we have our advisor, our expert from the PAHO WHO office, Dr. Woolford, joining us today. Dr. Woolford, welcome to Kaichor Radio, ma'am.
Thank you very much, Mr. Mahadeo. Welcome.
And I do certainly hope that all of the staff and your PWR are all enjoying good health, notwithstanding the COVID-19 challenges
yes.
to Guyana.
Yes, they are.
Thank you. Well, let's get right into it, Doc. You know, we, as I said at the top just now, we would have had a couple of concerns expressed to us from our viewers and listeners. We do know that PAHO, yourself included, would have been instrumental in spreading, disseminating information on how to protect ourselves and so forth. So, Dr. Woolford, you would have been part of the PAHO that looks at how immunization is being done. You are the one that advises us year after year to ensure that we get our children on the go, take their vaccines and stuff like that. What are your thoughts and what do you have to tell our viewers and listeners with specific reference to vaccines? Should I continue to take my child for his regular checkups and his regular immunization vaccines?
Thanks, Mr. Mahadeo. Yes, the question is yes. However, the decision to maintain vaccination services should be determined by the national guidelines of the country, and especially in the light of COVID-19, such as physical distancing, hand washing, you know, avoiding of touching the eyes, nose, and also your respiratory hygiene, whatever the country advocates in terms of using of the mask. We also advocate in terms of WHO that priority should also be given to the elderly persons, the adults, the persons with chronic illness, health personnel as well, to make sure that these persons are also properly vaccinated. And then where they go for vaccination, all the rules in terms of COVID-19 would apply. For example, the facility having adequate hand sanitizer and hand washing facilities, and they will be screened also prior to entry. So in a nutshell, yes, but with proper screening and proper national guidelines of carrying out in terms of the COVID-19 pandemic.
Thank you, Doctor. So in other words, we must, regardless of what is the facet of life and lifestyle at this moment, we have to adhere to the guidelines and the pandemic. Doc, with regards to the clinics themselves across the country, would you be able to comment as to whether the clinics themselves, let's say the health centers, both private and public clinics, whether there is any means of you knowing that they are enforcing these guidelines like physical distancing and so forth?
Well, PAHO worked with the Ministry of Public Health recently on their national guidelines in terms of COVID-19 in relation to maternal child health and also immunizations. And we know also that the physical guidelines in terms of COVID-19 was stressed in terms of screening of persons, in terms of ensuring there's hand sanitizer, ensuring that whatever care that the person should be done One of the other important things that we have in the guidelines is that in terms of social or what we call now physical distances, we want to make sure that they have appointment times so that you won't crowd a session. So these are some of the things that we have put forward to the Ministry of Health, and the Ministry of Health has a monitoring team to see if this is actually being done on the ground.
Okay, thank you. And what about with regards to the pandemic itself, doctor? Would there be any major lessons that you and your office there would have garnered during this pandemic with regards to the future? I mean, is it going to reshape how we do things in the future? Are there any specific lessons you want to point to that the pandemic has brought to PAHO WHO?
Right. One of the important lessons that we've learned, and I think you've been hearing it on the region all over, is that a good intact immune system is important to prevention of COVID-19. That's what we learned. And also to prevent vaccine preventable diseases. So if you look at what vaccines are, they prepare the body to fight disease, exposing them to these symptoms, okay? So they prepare the body. And when any foreign germ or bacteria enter the body, immune cells react, and you got what you call antibiotics. And these antibiotics fights the germs, okay, and you build up your immune response. That's why we're advocating from PAHO WHO that if a child needs measles, if a child needs mumps, whatever vaccine the child needs, because she needs to get it, because having a vaccine prepare your system, your immune response to fight against infections. And the thing is that I think many persons in Guyana, is kind of complacent because for many years they have not seen any vaccine preventable disease. They haven't seen a case of measles, they haven't seen a case of polio, yellow fever, whooping cough, diphtheria, etc. And this is because the parents on the ground has been responding to the EPI program, has been taking the children to the vaccination program to ensure that they are vaccinated. So I want to encourage the public out there, even at this time during the COVID-19 pandemic, and we have seen so many success of the EPI program that you need to continue, call your nurse within your area, make sure that you schedule appointment, and make sure also that you keep up to date. But not only vaccination for the child, but for the adult as well, because we would like there's some high groups, as I said earlier, in terms of pregnant women and the elderly, and of course, health workers also, who are the frontline workers, need to keep up to date with their vaccination. So it builds your immune response, and for the pandemic, you need a good immune response as well.
Correct. Thank you for that. Interesting. Doc, every day babies are being born in this country, and in every country, notwithstanding the pandemic. Are there any, how do I protect my newborn from the pandemic? What specific precautions you advise?
Yes, as we know, COVID-19 is a relatively new disease, and research is still ongoing, and we still do not know if a pregnant woman with COVID-19 can pass the virus to a fetus or baby during breastfeeding. But what WHO is advocating that the baby needs something we call kangaroo care, the love, the bonding, etc. the baby needs. And what they're recommending that the mothers can look after the baby, taking all the COVID-19 guidelines in terms of respiratory hygiene, use of a mask, hand washing, etc. So in terms of protecting your baby, what we are saying, we're advocating for the bonding of the mother and the baby, the early close contact, because the contact between the mother and the baby early in line has a good response for the baby in terms of their well-being and their development. So the mother can look after the baby. In some cases, if the mother is too sick, then the mother will have to be separated from the baby. She would have to be fed, the baby would have to be fed breast milk substitute. So it depends on the situation of the mother. If she's well, if she's too sick, the response will vary.
Right. Doc, here is a peculiar question, and it's coming maybe from somebody who is coming from a father. So but it's peculiar to every home that would have a young child that is breastfeeding. How do we what kind of precautions do we take with regards to breastfeeding? And can you educate us if somebody has the disease, if a mother who is breastfeeding has the disease, what precautions should that mother take? Should she continue breastfeeding?
Yes, so I think one of the questions asked, I would respond to you with a question first by most people asking, can COVID-19 be passed through breastfeeding? I think that's what most people want to know.
Correct.
The COVID-19 virus has not today been detected in the breast milk of any mother who are confirmed or suspected of COVID-19. It appears unlikely if it would be transmitted through by breastfeeding by giving breast milk. So this is, as I said, is a very new disease, and this is what the research has been saying. So the other question is, should the mother continue to be feed if she's confirmed and suspected? Now, we would say yes. As I said before, the COVID-19 virus has not been detected in breast milk or breast milk feeding. And for example, the wearing of a mask is important again here in terms of the mother to reduce the possibility of the droplets with the baby and the mother. And why we're saying yes is because breastfeeding reduces the potential of the child. In simple words, when a mother breastfeeds her child, she passes over certain nutrients to the baby. So that builds the baby's immune response as well too. So what they're saying is that these nutrients is performed and it helps the baby as well to build a good immune response. And as I said before earlier, if the mother is so sick that she can't breastfeed, then we separate the baby, we give breast milk substitutes, and someone else will help to look up. So it all depends on the situation of the mother at that time. If she's very sick, if she's not very sick.
Understood, understood. So there you have it, ladies and gentlemen, viewers, listeners. We all need to be very cautious with the pandemic being on. And we are joined by Dr. Woolford, who looks into the area of child care, immunization, and all of that. And, we want to focus on this area of how we can continue protecting our children. Dr. Woolford has advised that please keep on top of your immunization program, but ensure that anything you do when you seek medical attention or you seek any attention from the medical services, that you maintain your physical distances and wear your masks and so forth. Doc, thank you so much for being here. Is there any other information you want to share with the population?
Vaccination has saved lives throughout the years, and Guyana has a very good track record and not having a case of any vaccine preventable disease for the last 10 years or more. So I would want to encourage the public out there, check your immunization cards, see what is needed, and call the nurse in your area, and she can, schedule a time for you to visit. That's what I like to leave with the general public.
Okay, thank you so much, Dr. Woolford, for joining us. Do give our regards to the team at PAHO WHO, and we look forward to having you on our program again in the future to talk about, more child care and immunization and all of that when your program gets started, Dr. Woolford. Thank you so very much.
Okay, bye.
Bye-bye.